Hello, my name is Bill Eisminger, and I'd like to talk to you today about home health nursing. I've been a nurse for 5 years. I work for you at PMC Pinnacle Health, and what I find is a lot of times we have patients come in that have gotten sick, or they've had a fall and they have broken bones, and we find that they can no longer take care of themselves at home like they were previously. So there are many options, but many times the patients go home with what we call home health care, and they have a nurse come and visit them to perform duties. So home health nurses manage your care in your home. Many of you, so you can see they're educated in a college or university. They're licensed and registered by your state. They belong to professional nursing associations such as the Home Health Nurses Association, or the Home Health Care Nurses and Palliative Care Association. They're also experienced. They have to have experience in med-surg, which is a medical surgical floor. They have to have experience in mental health, gerontology, which is taking care of older population, pediatrics, which is children, and then they have to have experience in community health, which is, of course, folks that live out in the community or, say, in a nursing home or whatnot. So what do they do? What do home health nurses do? They take your vital signs, like your blood pressure and heart rate. They take your temperature, respiratory rate, and oxygen saturation rate. They also go over your medications. So they go over the 5 rights. They make sure you're taking the right drugs. They're making sure you're taking your own drugs and not your pets, like your dog's medications. I've seen that happen before. They're making sure you're taking the right dose, like, say, taking 1 pill instead of 2. They're making sure you're taking it the right way, and they're making sure you're taking it at the right time and frequency. So they're making sure you're taking it in the morning and the evening, or just in the morning, and not getting them mixed up. Next, they talk to you about your plan of care, what we need to do to make sure things are getting done. They talk to your doctor, your family, and also specialists. They coordinate your care between all of those. So the nurse does that. They also monitor your response to treatment. So if you're doing therapy, they're seeing how your strength's going. If you're taking medications, they're seeing how it's affecting, say, your blood pressure, or your urine output, or labs. They talk about your needs. What do you need? Do you need more help? Do you need less help? Do you need someone to get groceries for you? Those are many of the things they talk about. And then they collect data. Are you still smoking? Do you still have family members that can help you? So those are some of the things they talk about when they collect data. Also, they do wound care. So let's say you've fallen and you've gotten hurt. They perform wound care. Also, they take care of you, help you with your mobility and activities of daily living. So let's say you get around in a walker or wheelchair. They'll help you with that, transfer in and out of a wheelchair. They'll help you bathe and get dressed. Those types of things. Personal hygiene. They do those things as well. So all in all, home health nurses are here to help you and your team work together so that you get your best care possible. Thank you.